The brain is the largest sex organ. Dopamine, oxytocin, and serotonin are released during sexual activity, contributing to pleasure and bonding. Kissing releases endorphins, which can reduce pain. The average duration of sexual intercourse is around 5 to 7 minutes. The Coolidge effect refers to increased sexual interest when encountering new partners. Men tend to have a higher sex drive than women on average. Women are more likely to experience multiple orgasms than men. Testosterone is associated with libido in both men and women. The refractory period is the time following orgasm when a person is less responsive to sexual stimulation. Sexual fantasies are common and varied, often involving themes of power, novelty, or taboo. Freud proposed that sexual energy is a driving force behind human behavior. The Kinsey scale measures sexual orientation on a continuum from exclusively heterosexual to exclusively homosexual. Sexual orientation is believed to be influenced by a combination of genetic, hormonal, and environmental factors. The clitoris has more nerve endings than any other part of the human body. The G-spot is an erogenous zone located about 1–2 inches inside the vagina on the front vaginal wall. Female ejaculation, or squirting, is the expulsion of fluid from the skin's glands during sexual arousal or orgasm. The average size of an erect penis is around 5.16 inches, 13.12 centimeters. Premature ejaculation is the most common sexual dysfunction in men under 40. Erectile dysfunction affects an estimated 30 million men in the United States. Performance anxiety can contribute to sexual difficulties in both men and women. The concept of sexual consent emphasizes the importance of mutual agreement and respect in sexual interactions. Rape culture perpetuates attitudes and behaviors that normalize sexual violence and disregard consent. Sexual assault can have long-lasting psychological effects, including PTSD, depression, and anxiety. Condoms are highly effective at preventing the transmission of sexually transmitted infections, STIs. Birth control pills work by preventing ovulation and thickening cervical mucus to block sperm. Performance anxiety and relationship issues can contribute to erectile dysfunction. Erectile dysfunction can be treated with medications such as sildenafil, Viagra, lifestyle changes, therapy, or a combination of approaches. Hypoactive sexual desire disorder, HSDD, is characterized by a persistent lack of interest in sexual activity. HSDD can be caused by hormonal imbalances, medications, stress, relationship issues, or underlying health conditions. Sex therapy can help individuals and couples address sexual difficulties, improve communication, and enhance intimacy. The Masters and Johnson sexual response cycle includes 4 stages: excitement, plateau, orgasm, and resolution. Sexual arousal is influenced by psychological, physiological, and environmental factors. Sexual dysfunction refers to problems with sexual desire, arousal, orgasm, or pain that persist and cause distress. Performance anxiety can interfere with sexual arousal and satisfaction. Mindfulness practices, such as meditation, can enhance sexual awareness and pleasure. Sexual satisfaction is influenced by factors such as communication, emotional intimacy, and physical pleasure. Open communication about sexual desires, boundaries, and preferences is essential for a healthy sexual relationship. Differences in sexual desire and preferences are common in relationships and can be negotiated through compromise and understanding. Sexual orientation encompasses a person's emotional, romantic, and sexual attraction to others. Sexual fluidity refers to changes or variations in sexual orientation over time or in different contexts. Gender identity is a deeply felt sense of being male, female, or something else, which may or may not align with the sex assigned at birth. Transgender individuals may experience dysphoria related to their body or gender identity, which can impact sexual experiences and relationships. Gender dysphoria is a psychological condition characterized by distress related to the incongruence between one's gender identity and assigned sex. Transitioning may involve social, medical, or legal changes to align one's gender presentation with their gender identity. Heteronormativity refers to the assumption that heterosexuality is the norm or default sexual orientation. LGBTQ+ individuals may face discrimination, stigma, and marginalization, which can impact mental health and well-being. Emergency contraception, often referred to as the morning after pill, can prevent pregnancy if taken within a few days of unprotected sex. Plan B is a brand of emergency contraception available over the counter in many countries. In vitro fertilization, IVF, involves fertilizing an egg with sperm outside the body and implanting the embryo into the uterus. Sexually transmitted infections, STIs, can be transmitted through sexual contact, including vaginal, anal, and oral sex. HPV is the most common sexually transmitted infection and can lead to cervical cancer. HIV/AIDS is a viral infection that weakens the immune system and can be transmitted through sexual contact, sharing needles, or childbirth. Gonorrhea and chlamydia are bacterial infections that can cause infertility if left untreated. Syphilis is a bacterial infection that progresses through stages if untreated, potentially causing serious complications. Herpes simplex virus, HSV, causes genital herpes, characterized by painful sores or blisters in the genital area. Hepatitis B and C are viral infections that can be transmitted through sexual contact and can cause liver damage. Trichomoniasis is a parasitic infection that can cause vaginal discharge, itching, and discomfort. Pelvic inflammatory disease, PID, is an infection of the female reproductive organs, often caused by untreated STIs. Asexuality is a sexual orientation characterized by a lack of sexual attraction to others. BDSM, bondage, discipline, dominance, submission, sadism, and masochism, encompasses a variety of consensual sexual practices and role-playing. Tantric sex is a practice that emphasizes mindfulness, connection, and prolonged sexual pleasure. Pornography can have both positive and negative effects on individuals and relationships, depending on frequency and content. Sex addiction is a controversial diagnosis characterized by compulsive sexual behavior despite negative consequences. Kegel exercises involve contracting and relaxing the pelvic floor muscles to improve sexual function and urinary control. Vaginismus is a condition characterized by involuntary muscle spasms that make vaginal penetration painful or impossible. Dyspareunia is recurrent genital pain associated with sexual activity. Vulvodynia is chronic pain or discomfort of the vulva, often exacerbated by sexual activity. Erectile dysfunction can have psychological, physiological, or both